everyone, today I want to tell you about a young man who was in a terrible car accident. He was driving home late at night when another car suddenly ran a red light and hit him on the driver's side. The impact was strong and his body was thrown against the door. Um, he had a fractured rib and a mild head injury. Right after the crash, he felt he, he felt dizzy, had chest pain and difficult breathing. It was a blunt force trauma and his condition was moderate to severe. Um, if he had worn his seatbelt correctly and avoid using his phone, it could have been prevent. Emergency service gave him oxygen, checked in the vitals, and took him to the hospital for X-rays and monitoring. Luckily, he made a full recovery.
A woman was cooking dinner when suddenly some hot oil splashed onto her arm. She screamed as the burning pain spread quickly. Her skin turned red and started to blister. It was a second-degree burn, a type of thermal injury. The cause was the splash of boiling oil, and it was considered moderate. Since it covered a small area, but was quite painful. To prevent this, she should have used long sleeves and keep the pot lid closed. She immediately ran her arm under cold water for several minutes, uh, then covered it with a clean cloth. Later, at the clinic, they cleaned the burn and applied special ointment. After a few weeks, her skin heals well.
A construction worker was fixing a roof when he lost his balance and fell about 3 meters to the ground. He landed on his side, hitting his leg and shoulder hard. The result was a broken leg and bruised shoulder. This was a blunt trauma caused by impact with a hard surface, and it was severe cause of the fracture. He had intense pain, swelling, and could not move his leg. To prevent this, he should have been wearing a safety harness. First aid include immobilization the leg and calling emergency service. And the hospital doctor placed a cast and gave him pain medication. It took months, but he eventually returned to work in safety.
A chef was cutting vegetables quickly during the lunch rush when he accidentally sliced his palm deeply with a sharp knife. Blood started flowing fast, and he felt a sharp pain. It was a penetrating injury, especially a deep laceration, and it was moderate. The cause was careless nip handling. He should have used a stable cutting aboard and focused on his taste. He pressed a clean tower to stop the bleeding, kept his hand raised, and went to the clinic. There, they cleaned the wound, gave him stitches, and updated his tetanus shot. With proper care, the wound healed and left only a small scar. A reminder to always be careful at the work.